Hello and thanks for joining us on TVC News this hour. Let's tell you that the report contains more disturbing image as viewer discretion is advised. We are staying with the developments in Jigawa State, where the death toll from the devastating tanker explosion has risen to 168. Others receiving treatment in various hospitals in Jigawa, Kano. Yobe State residents are still mourning the death of their loved ones.
A very tragic and catastrophic incident, and it's something that we pray will never happen again. We've visited the hospitals. We've also been at the scene with this delegation from the federal government, and as you can see, the National Emergency Management Agency, in conjunction with the State Emergency Management Agency, has been on ground from when this happened, and we're still on ground. We visited the hospitals today, and we're going to complement the efforts of the state government by providing more drugs to assist.
The accurate number now is 168. This we realize some of them some of them are not together with the population of the first burial. The second scene of the burial, some people were taken to their homes for burial.
With the inauguration of Road Safety Advisory Council by the Vice President about 2 weeks ago, things are going to change. We are going to get more care, more attention, and more funding, so that together we reduce the crashes.
Still in Jigawa State, Governor Umar Namadi has commended President Bola Tinubu for a swift response and commitment to the well-being of victims of the devastating tanker explosion. The governor said the actions of the president demonstrate a sense of concern and responsibility. President Tinubu had sent a high-powered delegation to condole with the people and government of Jigawa State.
President and the Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, Senator Bola Ahmed Tinubu, for the concern he has shown since this thing happened to us in Jigawa State. Mr. President has asked his aide to call me immediately this thing happened, and he sympathized with us and he condoled us. And again, today he has sent a high-powered delegation under the leadership of the Secretary to the Federal Government. They came here. We went around with them since in the morning. They have seen some of the patients in the hospital, and we have also gone to the scene of the incidents. They have condoled the people, and we also went to the palace of the Emir of Ringim. They have condoled the Emir. So I think, and what the message conveyed by the Secretary to the State Government from the President is something that is giving us a lot of hope as a Jigawa people.
And away from Jigawa to some health stories. The national state engagement on HIV sustainability has taken place to ensure an effective and efficient disease response driven by local and partner leadership, ownership and financial independence. Experts believe this approach will be one step closer to eliminating HIV by the year 2030. TVC News' Kemi Balogun has the details.
Nigeria has made some progress in the HIV and AIDS response through an improvement in testing and treatment services for new infections and mother-to-child transmission of the disease. But experts say more still needs to be done. In 2023, Nigeria still recorded 45,000 new infections. To chart a new course for the HIV response in the country, the issue of sustainability is now on the front burner of discussions here.
We cannot do it alone. It cannot be done at the national level. We have to cascade this down to the state level. And over the years, a lot of parallel structures are in place, for the programs, a lot of vertical programs.
The agenda is to find solutions of improving sustainability on financing, local production of commodities, and also effective data gathering.
So in this conversation, making sure that the political leadership at the state level, it's important. I'm talking about governors, but I'm also talking about chairman of the LGAs. It is important that we look at our programmatic sustainability. which is ensuring that, so government institutions, the communities are involved in the implementation.
We cannot be talking about ownership and sustainability and importing more than 90% of what we do, the drugs, the reagents, and the test kits, all those things. We must produce condoms. We must try as much as possible to produce them in Nigeria, so that if we are talking about sustainability. Then health financing. I look at net financing that health insurance is a key, is the future.
And part of the sustainability is ensuring domestic resource mobilization, because of course financial program is very essential. Unfortunately, as we speak, most of the funding is driven by donors, but now we are talking about ensuring the necessary budgetary allocation, both at the federal government level, at the state level, and even at the local government level.
Nigeria remains on course to achieve the 2030 target of 95% of Nigerians living with HIV expected to know their status through testing services, 95% of all those with diagnosed HIV infection be captured in sustained antiretroviral therapy, and 95% of all people receiving antiretroviral therapy will have attained viral suppression. Kemi Balogun, TVC News, Abuja.
Healthcare experts and industry leaders are advocating for a digital revolution in the country's healthcare system. At the Healthcare Providers Association of Nigeria's Scientific Conference, an annual general meeting in Lagos, Professor Akin Abayomi, Lagos State Commissioner for Health, emphasized the need for innovative solutions to tackle the challenges facing Nigeria's healthcare system. Sarah Ayuko has the details.
Still surviving from a brain drain, Nigeria's healthcare system is on the verge of a digital revolution. Here, top experts and industry leaders at the Healthcare Providers Association are calling for widespread adoption of digital solutions to transform the health sector and ensure massive integration of the vulnerable into the health insurance scheme.
The Lagos State government has demonstrated commitment to the NHI Heart 2020, 2022, and our home previously Lagos State Health Scheme, which was made mandatory from inception.
This is an opportunity for us to reduce the low enrollment rates. It's very important that Nigerians are educated on what health insurance is, on how they can access it, on the benefit that comes with it, and how it can help improve their life. And we can leverage social media for this. Health influencers, health educators, Facebook groups, WhatsApp communities, TikTok, Instagram content cannot be leveraged.
Out of 25 million people living in Lagos, over 1.8 million residents are insured through private health maintenance organization, with an additional 1 million benefiting from public schemes. The government says it is reinvesting in its equity fund to cover vulnerable residents who cannot afford insurance.
And the challenges of health insurance, particularly social health insurance for us in Lagos, are numerous. Our citizens lack an insurance culture. In other words, whatever the case may be, we prefer to wait till there's a need before you secure some kind of advanced protection against a shock, whether it's a car accident, a catastrophe at home, your life, or your health. And so it's important for government to start to introduce and to promote the concept of insurance, not just for health, but across the board.
Health experts say although a regulatory framework will be established to maintain high standards among accredited healthcare providers, Nigerians should adopt digital technology and health insurance. Sarah Ayuku, TVC News, Lagos.